uterus, fundus of the uterus, then body, corpus, and neck. And neck of the uterus insert into vagina, that is vagina. And this part of the cervix, which is insert into vagina, that is portio vaginalis, and above of fornix of vagina, that is portio supravaginalis, supravaginal portion and portio vaginalis. Then here it is fallopian tube here and here, and part of the uterus which is above of fallopian tube, that is fundus, and this part that is body of the uterus. Fallopian tube, part of fallopian tube which is inside of uterus, that is pars uterina. Then near of uterus, that is isthmus of fallopian tube. Then widest part is ampule, and ampule finish with infundibulum, and wall of infundibulum, which is surround ostium abdominale tuba, it has fimbria tubaria, and one longest fimbria which is attached to the ovary, here it is ovary, that is fimbria avarica. Laterally from uterus we have peritoneum, which passes here and here, intraperitoneal position. If we cut in horizontal plane, look here, this is wall of pelvis. Here it is pubic symphysis, here it is sacral bone. This is rectum, here it is urinary bladder, and here it is uterus. And peritoneum, we know that urinary bladder has what? Extraperitoneal position. In rectum, for example, here, just a moment, this is mesoperitoneal position of rectum, and this double layer of peritoneum, which start from lateral side of the pelvic cavity and goes to the uterus, this double layer of peritoneum, that is what? That is mesometrium. Uterus, that is Latin name. Metra, that is Greek name, and another Greek name, hystera. Mesometrium, that is mesentery of the uterus, mesometrium. Or another name, it is broad ligament. And uterus has intraperitoneal position. Intraperitoneal position, this is mesometrium or broad ligament. And upper part of broad ligament, which is, look here, this is fallopian tube. This is fallopian tube. Here it is broad ligament. And broad ligament comes to fallopian tube and surround it. That is why fallopian tube also has intraperitoneal position. And fallopian tube is in upper part of the broad ligament, and this part of the broad ligament, this double layer of broad ligament, which is attached to fallopian tube, has name mesosalpinx. Salpinx, that is Greek name of fallopian tube, salpinx. Mesosalpinx, that is upper part of the broad ligament, which attached to fallopian tube. And ovary, look here, this is anterior side, and this is posterior side, and this posterior layer of broad ligament attached to the ovary, that is ovary. But ovary is not supplied with peritoneum. Peritoneum not surround ovary. Only here it is, we have epithelium on the surface of ovary, but this double layer of peritoneum which attached to this is margo mesovarium of the ovary. This is mesovarium. This double layer of peritoneum from posterior layer of broad ligament which attach to the ovary. That is mesovarium. This is mesosalpinx. This is mesovarium, and this is broad ligament or mesometrium. Now, fallopian tube has three coats. External, that is peritoneum, serous coat. Middle layer is muscular, longitudinal and circular fibers. And inner layer is mucous membrane, and mucous membrane has ciliated epithelium. Now, uterus, we already said parts: fundus, body, cervix, and cervix has portio supravaginalis and vaginalis. Wall of the uterus has three coats: external coat, that is peritoneum, serous coat, then a muscular coat, it also has longitudinal circular muscles, and inner layer is endometrium, that is mucous membrane, external, that is perimetrium, that is peritoneum, myometrium, muscular coat, and endometrium, mucous coat, and here it is also ciliated epithelium. Well, some words about ligaments of the uterus. We already said which ligament? Broad ligament. What else except broad ligament? Here at the base of broad ligament, connective tissue goes to the neck of the uterus. Here it is between two layers of peritoneum. This is connective tissue which goes to the neck of the uterus. It has name ligamentum cardinale uteri. Ligamentum cardinale. It's fixed neck of the uterus. What else? Between pubic symphysis and urinary bladder, we have ligamentum pubovesicale, and this ligament continues to the neck of the uterus as ligamentum vesicouterino. The same here, pubovesicalis and vesicouterino. And posteriorly we have ligamentum sacrouterinum, and ligamentum rectouterinum. All of these ligaments fixed neck of the uterus, and one ligament goes to the body and attached below from fallopian tube. Here it is placed where round ligament, ligamentum teres uteri, it passes through inguinal canal and then continues and attached to the fundus in place below of fallopian tube. It's attached to the body, it is better, body of the uterus below of fallopian tube. That is a round ligament of the uterus here and round ligament here. Start from pubic symphysis, passes through inguinal canal, and then goes backward and fixed body of the uterus. That is a round ligament of the uterus. I put numbers. Number 1, ligamentum cardinale. Number 2, ligamentum teres uteri. Number 3, ligamentum pubovesicale. And number 4, ligamentum vesicouterino. Number 5, ligamentum sacrouterino. And number 6, ligamentum rectouterinum. All ligaments except round ligament, except teres ligament, fixed neck of the uterus, and only round ligament fixed body of the uterus. And uterus has, look here, all of my diagrams only for your understanding, not necessary to draw. If we cut in sagittal plane, here it is pubic symphysis, this is urinary bladder, here it is rectum, this is rectum and canalis analis, and this is uterus, look here. Fundus of the uterus, it looks forward, and this is neck, cervix of the uterus, and here it is vagina, anterior fornix, and here posterior fornix. That is normal position of uterus, and we can see angle that is between body and cervix, and this angle opens forward, it looks forward. That is, this angle has name anteflexion. And in this case, fundus of the uterus looks also forward, that is anteversion, that is normal position of uterus. If urinary bladder, it's full with urine, look here, this is pubic symphysis, this is urinary bladder with urine. In this case, look here, what happened? That is, the fundus of uterus moves backward because urinary bladder here it's enlarged in size, and now fundus of the uterus looks backward, that is a retroversion, but this angle between body and cervix opens forward, that is anteflexion, but retroversion. It is also normal. Only what changes? Size of urinary bladder. And what is abnormal position? This is pubic symphysis, this is urinary bladder, and this is position of uterus. Here it is rectum and canalis analis. And now we can see that angle between body and cervix looks backward, and fundus the same looks backward, that is retroversion, and a retroflexion, that is abnormal position. Retroflexion, maybe problems in time of pregnancy, problems with fertilization, that is not very good. What else? Some words about vagina. We already know that peritoneum from rectum goes to posterior fornix of vagina. After that, it surrounds uterus, and from uterus goes to urinary bladder. And we have two pouches:
excavatio recto uterina, excavatio vesicaluterina.
And a rectouterine pouch
is
Douglas pouch. It is deeper than vesicaluterine pouch. And we can see that posterior fornix of vagina supplies with peritoneum, but anterior fornix not supplies. That is why, if it is necessary, we can make punction of this fornix and comes to Douglas pouch. If we have blood or pus, we can remove this fluid and we will see what is the problem in abdominal cavity. Only here, only in posterior fornix of vagina. Vagina has two walls, anterior wall and posterior wall, and both of them has short oblique folds, and these folds has name ruga vaginalis, and these folds makes a column on anterior wall of vagina and on posterior wall. This is columna rugarum anterior and columna rugarum posterior. And ostium vagina opens into the vestibule of vagina in space between labia podensi minoris. Now what we can see in preparation.